Today's policy experts are joining me, and they include Scott Bruner. Scott is the Coverage and Access Strategy Team Leader for KHI. His area at KHI covers Medicaid, fiscal policy, healthcare delivery, insurance coverage, and more. Also joining me today is Ivan Williams, and Ivan is the author of our annual insurance update, and he will be handling the majority of today's presentation. Ivan also covers issues surrounding health reform, Medicaid, CHIP data analysis, and health impact assessments. Before we go further into the slides, I'm going to go back over housekeeping with regards to the technology today because we had a little bit of an interruption, so I'm just going to repeat a little bit of the information addressed earlier. If you are connecting through Adobe Connect on the internet, you'll be able to hear the entire webinar and see our slides from your internet browser. We will take questions at the end of the presentation. You can submit questions through your text box at the right-hand side of your screen, and we will also open up your microphones through Adobe Connect so that you can ask your questions via phone. When asking your questions, we do ask that you provide your name and where you're from. If you're using your telephone to connect, your line is muted. I'll unmute the phone when we are finished with the presentation, and you can ask questions through the phone. As one additional reference, we have placed a copy of the slides on the KHI website at www.khi.org, as well as a frequently asked questions document about the Census Bureau data. We are recording today's webinar, and we will also place a recorded copy out on the same webpage. Now I'm going to go ahead and turn things over to Ivan Williams.
All right, I'm going to talk about the two major data sources that come from the Census Bureau in terms of health insurance coverage. The first one is called the Annual Social and Economic Supplement to the Current Population Survey, or CPS, and that's how I'll refer to that survey throughout the presentation. The other one is a newer survey called the American Community Survey, and both of these are Census Bureau surveys. Tomorrow, the CPS estimates will be released by the Census Bureau for 2012. There won't be an embargo on this, so that data will be available to the public and to the media at the same time. And then just 2 days later, on September 19th, the Census Bureau will release their 2012 ACS one-year estimates, embargoed on September 17th. So actually later tomorrow afternoon, that data will be available to the press. And I might point out that that's one-year estimates. The CPS estimates that are released tomorrow will, for the state level estimates, will be in the form of two-year estimates. And I'll get into that more later. So you might ask, why are there two different estimates just 2 days apart? Well, first of all, the Census Bureau has decided on their release schedule. The CPS Annual Social and Economic Supplement is the official source of poverty estimate. So that information will be available tomorrow along with the healthcare data and other information from that survey. The Census Bureau recommends using the CPS data for the national estimates of health insurance coverage and the ACS for subnational estimates. So first of all, I'll go through here a comparison of the two surveys. The Annual Social and Economic Supplement is the source of official national poverty estimates, as I mentioned earlier. The ACS, on the other hand, is a completely separate survey that was designed to replace the decennial census long form. The sample sizes are very different between the two surveys. While the CPS includes 100,000 addresses annually, the ACS has over 250,000 addresses per month, or about 3 million addresses annually. Another important distinction is the data collection period for the two surveys. The CPS survey that asks the health insurance questions is only conducted between February and April of each year. And during that time, the questions are phrased to look back at coverage during the last calendar year. The ACS, on the other hand, is a continuous year-round survey, and it asks the health insurance questions about coverage at the point in time of the interview. There's also big differences in how long the data has been available. As you can see on the slide, the CPS has data since 1987, and the ACS, the health insurance questions on it have only been available since 2008. And there are some differences in the survey modes that are used too. So which survey does KHI recommend using for Kansas? We recommend using the ACS, and that's primarily due to its much larger sample size. As a result of that larger sample size, it has a smaller margin of error, and the availability of state-level data for a single year is also an advantage of the ACS. Both surveys do reveal similar trends over time. I might note, don't be surprised if you do see us use CPS or other data to answer a particular question. There are cases where, despite the smaller samples and other things, the other survey sources may actually be better for answering particular questions. And I've provided just a couple of examples of those below. One of them, for example, would be the longer-term data, because as I mentioned before, the CPS data is available back to 1987, and the ACS data is only available since 2008. I also should mention that there are going to be some future health insurance coverage data releases. There will be, on October 24th, an ACS 3-year estimate set of data that is released, and then on December 5th, ACS 5-year estimates. And so you may wonder, what are we talking about when we say 1-year, 3-year, or 5-year estimates? The ACS 1-year estimates include statewide estimates for the entire state, as well as estimates for smaller geographic areas, such as counties with a population of over 65,000. I'm sorry, I moved ahead of the slides a little bit. Those counties that the 1-year estimates are available for are Johnson, Sedgwick, Shawnee, Wyandotte, Douglas, Leavenworth, Riley, and Butler counties. They each have a population greater than 65,000. To provide the smaller geographic area estimates, the Census Bureau combines data for multiple years, so that with a 3-year estimate, you're able to have estimates for counties or areas with populations that are greater than 20,000. And finally, with the 5-year estimates that will come out in December, we will be able to look at all counties in the state, as well as areas down to the census block group level. On this slide, you can see which counties and which areas, such as Wichita, Overland Park, Olathe, Kansas City, Topeka, and Lawrence, will have estimates for with the 1-year data. So each of these areas are large enough that there will be data provided on health insurance coverage coming out later this week. So how do you obtain the latest health insurance data, particularly the American Community Survey, or ACS data, that we recommend using? First of all, the data tables are available via American Fact Finder on the Census Bureau's website. And I've provided on this slide the URL for you to access that site. I've also provided just some quick instructions here for how to get to Kansas level data for those 1-year estimates. So those are kind of step-by-step instructions. You can also follow these instructions to get the data for one of those counties that I mentioned, or places, the cities that I mentioned, but by changing the geographic type from state to either county or place, and then the name of the particular county or place that you're interested in looking at. I also wanted to point out some of the most useful ACS health insurance coverage data tables. First of all, the number and percent uninsured, both overall and for standard demographic groups, is provided in a table titled Health Insurance Coverage Status, Table S2701. There's also a related table that may be of interest called S2702. Another table that may be of help is insurance coverage by type of coverage. So employer-based, Medicare, Medicaid, those major types of coverage. That data is available in table B27010. The table numbers that I mentioned, I included in the presentation because they can be directly entered on American Fact Finder under the Advanced Search tab. Now when you enter those, you'll also need to indicate what geography that you're wanting to look at. Another piece of information that is actually new this year from the Census Bureau with the ACS data are detailed tables for 19 to 25-year-olds. And the reason they're providing these is since September of 2010, the Affordable Care Act allows dependents to stay on their parents' or guardian's health insurance plan until they are 26. And so these two new health insurance detail tables, B27022 and B27023 for young adults age 19 to 25, have data that provide the insurance status or rates for individuals in those age groups. We also wanted to mention some upcoming KHI publications. First of all, we will be providing a fact sheet on Kansas rates of health insurance coverage in early October. We will also provide a fact sheet with county-level health insurance rates by coverage source in mid-December, as well as additional local profiles in January, and then our annual insurance update, a complete report with all kinds of demographic breakdowns and so forth in March of 2014. So I think we're ready for questions, so I'll turn it back over to Lisa Jones.